Hi, my name's Amy and my speech is about dementia. I think it's important for STNAs to understand dementia since they take direct care of these residents. I'm going to describe a few different causes of dementia as well as ways to help reduce the risk of dementia. I would like to discuss the different stages of dementia to help the STNAs understand the dementia process of the ones that they provide direct care to or even their loved ones. I myself as an LPN have worked with many residents that have dementia and have seen the different stages and behavior changes my residents have had. My grandmother was diagnosed with dementia before I attended nursing school, so I was clueless to there being different stages, behavioral changes, and different things to expect. A very sad thing to see whether it's family members or a resident that's in your care. Dementia is a loss of memory and other mental abilities severe enough to interfere with daily living and activities. Dementia also causes physical changes in the brain. I'm going to talk about a few different types of dementia associated with dementia, such as Alzheimer's disease, vascular dementia, Wernicke-Korsakoff syndrome, dementia, and Lewy body and frontal temporal dementia, as well as ways to help lower your risk for dementia and also some behavioral changes that go along with this disease. Dementia is a specific disease, isn't a specific disease. It is instead described by a group of symptoms affecting the memory, thinking, and social abilities severe enough to interfere with daily functioning. Memory loss alone doesn't mean you have dementia. There's a certain amount of memory loss that is a normal part of aging. Dementia may also cause personality changes and impaired reasoning. Alzheimer's disease is the most common disease of dementia and is caused by high levels of certain proteins inside and outside brain cells that make it hard for a brain to stay healthy and communicate with each other. The first stage usually lasts 2 to 4 years, and the symptoms include loss of recent memories, like forgetting conversations and events that just happened, trouble driving, getting lost on familiar routes, hard times with everyday tasks such as following a recipe or balancing the checkbook, mood swings that involve depression or lack of interest, having less energy and drive to do things. I have one resident that I take care of that can't remember me being in the room from one time to the next, but can pull out a picture from her high school years and be able to name every single person that's in the picture. She always reflects back on her childhood and can remember lots of different things, including her birthday. The next dementia is vascular dementia. This is the second most common type of dementia. It is usually because they haven't had a major stroke or one or more silent strokes, which can happen without even noticing. These symptoms depend on which part of the brain that is affected by the stroke. The death of brain cells can cause problems with memory, thinking, or reasoning. When cognitive problems are bad enough to cause significant problems in everyday life, this is known as vascular dementia. Wernicke-Korsakoff syndrome. This disorder is caused by severe shortage of thiamine, which is also known as vitamin B1. This disorder most commonly happens in people who are long-term heavy drinkers of alcohol. Dementia symptoms most common with this condition is problems with memory. I have a resident with this diagnosis that she can remember her husband that walks into her room, but can't remember the last time she's seen him after he's left. The next dementia is dementia with Lewy bodies. This is the third most common cause of dementia. Early signs of this dementia is a lowered attention span, recurrent hallucinations, and fluctuations between periods of clear thinking followed by periods of confusion. As this disease progresses, it affects more parts of the brain, usually sleepiness during the day and periods of blanking out or staring occurs. Then there's frontal temporal dementia. This is where cell damages have been developed in areas of the brain that control planning and judgment, emotion, speech, and sometimes of movement. Some symptoms may include personality and behavioral changes, sudden lack of inhibitions in personal and social situations, problems coming up with the right words for things when speaking, and movement problems such as shakiness, bowel problems, and muscle spasms. There's dementia risk and preventions that we can all take to prevent ourselves from getting this horrible disease. Although age and genetics cannot be changed, there are other steps you can take to help prevent dementia on the vascular end. Is don't smoke, take steps to keep your blood pressure, sugar, and cholesterol in recommended levels, and also maintain a healthy weight. Regular physical exercise and a balanced diet may also help decrease the risk. Early diagnosis of dementia allows a person to get the maximum benefits from available treatments. Although there is no cure for Alzheimer's disease or advanced stages of dementia, there are always ways to reduce the risk of dementia. I think it's an important step when caring for either a loved one or one you're caring with dementia is to understand the disease process, how it affects the brain, and different stages that go along with it. It doesn't make the disease process any easier, it just helps you understand it better. I hope I've helped to differentiate between Alzheimer's disease, vascular dementia, Wernicke-Korsakoff syndrome, dementia with Lewy bodies, and frontal temporal dementia. Thank you for listening.